Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Pane, we have a question of the week here that came in from our Facebook page. It's a breast revision question, breast implant revision question, and the details are this person has a 375 cc Mentor implant, high profile and under the muscle. They have progressively gotten worse aesthetically, and they've had them done in December of 2014. It was a tuberous A cup. Their shape, size, and the symmetry is really disappointing. They're wondering, what do you think they could overall, how could it overall be improved? They've seen a few consultants, and they're looking for some really good advice. Dr. Pane, what do you suggest in this situation?
Well, that's a great one. Tuberous breast, what we're talking about is breast that's shaped in such a way that some of the breast tissue is coming up through the center part, through the areola. And you kind of know what this looks like. It's instead of a breast that's got a regular curve, there's kind of a curve and like a little, a little swelling there under the areola. And there can be a lot of variety to that. It can range from pretty mild and really no big deal to quite pronounced, where actually the tissue is coming through. In this case, I saw the pictures. What I think is going on is the person probably had mild tuberous breast, not really bad. But what probably happened is that the implant was larger than the breast itself. And then what happens is you've got the implant shape, and then you get the breast kind of stacked on top of that, and you have this kind of irregular curve on the underside. A little disappointing that the breast implant hasn't been in a long time, and a revision is already having to be considered, but that sometimes does happen. In this case, you're going to get a lot of different opinions from different surgeons because there's no exact perfect way to fix it. If there were, we would all say the same thing. As a result, what happens is people give you different opinions based on their background and experience. In my case, I think looking at those photos, the person probably will do well with a re-augmentation, probably with a smaller implant, and then a tightening procedure to secure that area around the areola is probably going to work out reasonably well. A second stage could be considered if needed, if there's that curve going on in the bottom part. Sometimes that can be fat grafted, but you're not usually going to do that at the same time, although it depends on the specific situation. So an in-person examination is going to be needed here. But this is one of the cases where I do encourage people to get a couple of consultations, because you're not going to get an exact single answer. Go with the person that's telling you what you're comfortable with and what you think, that if you think they're confident in what they can do. Some people will tell you that they don't want to touch this kind of case, and they'll refer you to other doctors. In our case, we want to see everybody. We'll take a look and give you an option that we think is going to fit best in your situation. So that's how I would handle that one. It's a little complicated, but good overall question.
Thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page or website. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.